the fecal immunochemical test, otherwise known as the FIT test, was increasingly deployed during the COVID pandemic, and now of course forms a crucial part of our colonoscopy triage process. The FIT test itself was discussed during our GastroLearning live show in June, and you'll remember that it uses specific antibodies to detect human blood in stool. The data will demonstrate that patients with a FIT of less than 10 had a colorectal cancer risk of about 0.5%, and those with a FIT of greater than 10 had about a 10% risk of colorectal cancer. Now, I'm not going to go too much through the guideline that's been published. Of course, you can read it here on our site, because actually not much of this has changed since Dr. Seward ran through the use of the FIT test. However, I would recommend, of course, you go back and watch it again. But I wanted to highlight a couple of areas within this guideline that have changed slightly, that I just want to draw attention to. Now, one hasn't really changed, but it's just a decision in regards to the cutoff value for the FIT test referral, and the other is a change in regards to the use of FIT tests in patients with iron deficiency anemia. The paper we're referring to here is the guideline published in Gut, which discusses the use of FIT tests in patients with signs or symptoms of colorectal cancer. So, firstly, it recommends that the FIT test should be used in primary care to determine if a patient should be referred on the urgent cancer pathway. It is recommended that a threshold of greater than 10 should trigger a referral. The decision on the threshold is always about finding that balance between sensitivity and specificity. So, for example, if the FIT test threshold was set at 150, the sensitivity would drop to only 64%, but the specificity would be as high as 95% for the FIT test. Now, if we drop that threshold down to 2, the sensitivity would increase all the way up to 93%, but the specificity drops to only 77%. The conclusion from the various studies was that the threshold of greater than 10 allowed there to be a sensitivity of 87% and a specificity of 84%, which was felt to be appropriate. And of course, this decision was made on the threshold, which took into account things like background prevalence of disease, the number needed to scope in order to detect one cancer, and of course, the number of missed cancers per 1,000 patients tested. An important statement in this guideline is that the Fizz test is highly sensitive in patients who are symptomatic, and of course, those symptoms include patients with iron deficiency anemia. The earlier studies that, of course, we discussed in our GastroLearning live show reported a drop in the sensitivity of the FIT test to around about 80% in patients who had iron deficiency anemia. However, this guideline states that these early publications were biased due to an over representation of patients with iron deficiency anemia. The larger studies that they quote within this guideline that have been published recently look at patients with iron deficiency anemia. It's a meta-analysis of 724 patients, and they found that a specificity in patients with iron deficiency anemia was 74%, and the sensitivity was 97% in patients who had a cutoff value of 10. And therefore, within these guidelines, actually, the use of FIT tests was felt to be adequately sensitive and specific in patients with iron deficiency anemia. So have a look at these guidelines. There's a lot there. As I said, there isn't much that's changed since our discussion with Dr. Seward, so I'd certainly recommend you go back and watch our live show again.